Hello, my name is Eric Bricker and I'm the Chief Medical Officer of Compass Professional Health Services. As the Chief Medical Officer, I'm a general internist, primary care physician, did my training at Johns Hopkins Hospital in Baltimore, Maryland. And Compass is a healthcare consumer advocacy firm. We provide tools and support to healthcare consumers. We support about 1,100 employer clients across the country and support their employees and their family members. And today we're going to talk about cancer doctors. And so cancer doctors are typically referred to as oncologists. There are several different types of oncologists. So one, there are medical oncologists. And so medical oncologists are a subspecialty of medicine. They do not perform surgery. They oftentimes will treat people for any sort of side effects or symptoms related to their cancer. They will also administer the chemotherapy or the chemo. And oftentimes medical oncologists will work in conjunction with a surgeon. And so that could be a surgical oncologist, or it could be a general surgeon or a colorectal surgeon, also a cardiothoracic surgeon. And so if a tumor actually needs to be surgically removed, then there'll be another physician, a surgeon as well. There are also what are referred to as radiation oncologists. So certain types of cancers need to be sort of zapped with radiation, and that would be the radiation oncologist that administers that as well. So certain cancers like prostate cancer, breast cancer, colon cancer oftentimes include radiation therapy as well. So that's one, is that there's different types of cancer doctors or oncologists. So part two that's important to know is that there are what are referred to as comprehensive cancer centers in America, and there's about 41 of them. And a comprehensive cancer center is a special designation by the NCI, the National Cancer Institute, and basically these centers are specially equipped and trained to have sort of more integrated care. So as you can imagine, with all of those different physicians, you want to make sure that they're all talking to each other and coordinating the person's particular care. And at these comprehensive cancer centers, they have things like electronic health records and a team approach. And so when people are considering care for cancer, that it might be a good idea to actually have your care done at one of those comprehensive cancer centers. May not be right for everybody. You may not live near one, or you may be in a different situation, but it's important to know that these comprehensive cancer centers exist. Okay. Next thing that's important to know about cancer doctors is that in order to have a definitive diagnosis of cancer, oftentimes people need a tissue biopsy that needs to be examined by a pathologist. So it's almost impossible to make a diagnosis of cancer just from a CT scan or an MRI or any other type of scan. It oftentimes requires a tissue biopsy. And so sort of the term that's used with oncologists is tissue is the issue. So just know that potentially you or a family member has a diagnosis of cancer, that really the confirmation of that diagnosis by a biopsy and examination by a pathologist is really crucial in terms of determining what the next steps are, and if you really do have cancer. Sometimes things like rheumatologic conditions or things like infections can actually appear to be cancer, but they're actually not. And then so finally, the last thing that's important to know in regards to cancer doctors is that even within all of those different cancer specialties that I mentioned at the beginning, cancer doctors typically focus on one or two particular types of cancer. And so it may be helpful for you to really see a subspecialist that focuses on your particular type of cancer. So for example, some medical oncologists just specialize in breast cancer, or some just specialize in blood cancers like leukemia or lymphoma. And actually for prostate cancer, which unfortunately is very common, it's actually urologists, kidney and urinary tract doctors, urologists, that are the specialists for prostate cancer. It's actually not a medical oncologist. So when you're looking to find a physician, not only is it important to find an oncologist, but it might be important for you to really find an oncologist that really subspecializes in whatever particular cancer that you or a family member are dealing with. And so like I said, obviously cancer is a very serious subject, and it's obviously something that you and your family members want to take all of these points in consideration when considering care for this. And so I just really appreciate the opportunity to speak with you today. If you'd like more information on other types of subspecialties and other types of doctors, then please visit our Compass blog, where we have a lot of information on them as well. Thank you so much.